menstrual migraine in women especially. So let's talk about it. So menstrual related migraines affected up to 60% of the women who experience any type of migraines. They can occur with or without an aura. They can also occur before, during, or after menstruations and during ovulation period. Some researches have shown that menstrual migraines tend to be more intense, last longer, and have more significant nausea than migraines not associated with the menstrual cycle. In addition to standard treatment for migraine, women with menstrual-related migraines may also benefit from medications that affect serotonin level in the brain as well as hormonal treatment. So this was all about menstrual migraine. Now let's talk about another type of migraine, that is esophageal migraine. Now let's talk about it. So esophageal migraine is also known as migraine without headaches, aura without headaches, silent migraine, and visual migraines without headaches. This type of migraines occurs when a person has an aura but does not get a headache. And this type of migraine is not uncommon in people who start having migraine after age, that is 40. Visual auras are some of the common symptoms of this particular type of migraine, that is migraine without headache. With this type of migraine, the aura may gradually occur with symptoms spreading over several minutes and move from one symptom to another. After visual symptoms, people may have numbness, speech problems, and then feel weakness and unable to move a part of their body normally. So this was all about migraine without headache. Now let's talk about another type of migraine, that is estrogen withdrawal headaches. So hormonal migraines are linked with the female hormones, commonly estrogen. They include migraines during your period, your ovulation period, your pregnancy period, perimenopause period, and the first few days after you start or stop taking medications that have estrogen in them, such as birth control pills or hormonal therapy. So this was all about hormonal migraines. Now another type of migraine is stress migraine, which is a very common migraine. So let's talk about it. So stress migraine is not a type of migraine which is recognized by International Headache Society. However, stress can be a triggering factor for causing migraine. So there are stress headaches, and these are also called as tension type headaches or ordinary type of headaches. So if you think stress may be triggering your migraines, so consider yoga, pranayams, exercises that will get you relief. So this was all about stress migraine. Now another type, that is cluster migraine. What is cluster migraine? So cluster migraine is not a migraine type. It is defined by International Headache Society as there are cluster headaches, and these headaches causes extreme pain around and behind the eyes, often with tearing on one side, nasal congestion, and flushing. So this was all about the cluster migraine. Now next type, that is vascular migraine, and this is our last type, that is 13th one, vascular migraine. What is vascular migraine? So vascular migraine is a term that some people may use to describe a throbbing or pulsating type of migraine, which is mainly caused by blood vessels irritation, their blockage. So this was all about 13 type of migraines. I hope these types are very much clear to you guys. See, however, they may become worse following delivery due to sudden hormonal shift. Headaches during pregnancy need special attention to make sure that the cause of the headache is understood. Research is ongoing, but a recent small study showed that women with migraine during pregnancy experienced a high rate of having preterm or early delivery. Second, preeclampsia. Third, a baby which is born with LBW, that is low birth weight baby. And the certain migraine headaches may not be considered safe during pregnancy because this can include aspirin. If you have migraine during pregnancy, so work with your doctor to find ways to treat your migraines that won't harm your developing baby. So this was all about migraine and pregnancy. So migraine symptoms may begin 1 to 2 days before the headaches itself, and this is known as paradrome stage. And we have also already talked about the signs and symptoms, but now we will again repeat in an elaborated manner that what are the clinical features. So let's again discuss about the clinical features. So symptoms during this stage can include food craving, depression during an aura, and you may have problems with your vision, sensation, movement and speech. Example of these problems include difficulty speaking clearly, feeling a prickling or tingling sensation in your face, arms and legs, seeing shapes, light flashes or bright spots in front of your eyes. And next one is temporarily losing your vision. And the next phase is also known as the attack phase, and this is the most acute or the severe of the phases when the actual migraine pain occurs. In some people this can overlap or occur during an aura. Attack phase symptoms can last anywhere from hours to days. Symptoms of a migraine can vary from person to person, and some symptoms may include increased sensitivity to light and sound, that is photophobia and phonophobia. Second, nausea and vomiting, dizziness or feeling faint. Next, pain on one side of your head. This is a marked feature. This is a hallmark symptom here. Always in migraine there will be pain on only one side of your head, whether on the left hemisphere of your brain or whether in the right hemisphere of your brain. Okay, and it might be in your temples, and it will be pulsating and throbbing head like pain. And after the attack phase, a person will often experience the post-drome phase. And during this phase, there are usually changes in mood, that is mood swings and feeling. These can range from feeling euphoric, that is hallucination, and extremely happy, to feeling very fatigued and apathetic. A mild dull headache may persist, and the length and the intensity of these phases can occur to different. Migraine pains can be pulsating in nature, they can be throbbing in nature, they can be perforating in nature, they can be pounding in nature, and they can be debilitating in nature. It can also feel like a severe dull steady ache. The pain may start out as a mild, but without treatment will become moderate to severe. Now next we'll talk about the investigations, that what are the diagnoses that you can perform if you have any doubt that you are suffering from migraine. So these are the tests that you can perform to confirm that you are actually suffering from migraine headaches. Now we'll talk about those investigations, migraine tests. So, doctor diagnosed migraine by listening to your symptoms, taking a thorough medical and family history, and performing a physical examination also to rule out other potential causes. And the mostly used important migraine tests they are basically imaging scans like CT scan and MRI that are used to rule out other causes including tumor in your brain, stroke in your brain, abnormal brain structure. So basically there are two types of tests for diagnosing migraine, and they are of this presentation, that is management part. So if you are suffering from migraine, then what you will do, how you will manage that migraine, those migraine headaches. So about that we will talk here now. So what is the natural treatment for managing migraine headaches? So let's talk about the management part. So as we all know that stress is a very major migraine trigger, and there is nothing like a hectic day on the job to stress you out. Take a difficult boss and throw in some impossible deadlines, and you have the recipe for a monster migraine. So put a stress relief system in place on the job and follow these tips. So first, take 5-minute break throughout the day to meditate, breathe deeply, or take a walk outside for some fresh air. Second, stress gets overwhelming, so see a therapist or counselor for advice. And how you can control triggering factors. So control other triggering factors like bright lights, loud noise, and strong smells. They can all set migraine in you because they are the triggering factors for migraines. So first of all, dim the lights. So turn down the brightness on your computer monitor by simply closing a door. To soundproof a office, ask your company if they can extend the wall upwards or add pieces of carpet to the walls. If all else fails, wear earplugs or use a white noise machine to drown out loud sounds. Third, remove strong odors. Ask any coworker who go heavy on the perfume to take it easy on the scents. Explain your sensitivity to your office manager so they can ask the cleaning crew to avoid using strong smelling chemicals. Next, get more ergonomic. So position your computer monitor and chair to maximize your comfort and minimize your eye strains. Poor postures can cause tension in your body and trigger a migraine. Now let's talk about some lifestyle changes about the stress management. Loud sounds, noises, bright lights, and strong odors. And the second one is try relaxation therapy. Practice yoga, meditation, progressive muscle relaxation to relieve the stress that can cause headaches. Third, get into a sleep routine. Too much or too little sleep can both cause migraine headaches. Try to go to bed at the same time each night and wake up at the same time every morning. Next, exercise daily. Regular aerobic exercises like walking or bike riding can reduce both the frequency and severity of the migraines. Next, don't skip meals. Hunger is a big migraine trigger. Eat breakfast, lunch, and dinner every day, with snacks in between as needed. So these are some types of management point of view that you can follow if you are suffering from migraine headaches, and they will definitely work for you. So this was all about today. So in this video we have discussed about migraine, their various types of migraines, and what are the triggering factor that leads to migraine, what is the basic etiology, what are the causes, and how you can manage migraine if you are suffering from migraine headaches. So that's all for today. See you guys in our next video. Till then, stay connected with us for more videos like this. Don't forget to press the bell icon for more updates. Stay safe, stay healthy, and stay tension free. Don't forget to exercise, meditate, and practice yoga pranayams daily. And yes, thanks for watching our video.